Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. And iCON is, the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural public to know more about prevention of diseases. And also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health. So if you go to a doctor, the doctor tells you, well, you have diabetes, what do you have to watch out for, or you have to start taking medications. So a lot of times family doctors will refer you to someone in the community, some centers who have educational courses for diabetes. So what are the contents of these educational courses? Why should you go there? So these courses, these programs, as far as I know, should be free, but you have to be referred to by a doctor, and then you go to attend your classes to find out what is diabetes and what you should watch out for. So we're honored to have today an educator for diabetes, who is a registered nurse, Laura Ng, who will tell us about the contents of the diabetes education program. So if someone who is diagnosed with diabetes, they want to know what they want to learn and what are the resources in the community to help us. So I will pass the mic to Laura.
So hello, everyone. Thank you, Barbara. So I am Ms. Ng, and the nurse. So there are quite a few learning objectives. So let us take a look. So first of all, we would like to understand who the healthcare team members are and how they can help, and to learn self-management skills, and we have to learn them. And also we would like to know more about community sources and how they can be of help. So the next one would be about testing of blood sugar. So why do we have to test our own blood sugars? So just then the doctor has said that if our blood sugar is not controlled properly, there will be the risk of having complications. And how are we going to do tests? So actually there are 3 different ways of testing blood sugars. The first one is doing hemoglobin A1C, which is done in the lab, and the doctor will write a prescription, which is done every 3 months. But this is an average number to let us know what is the the result of your self-management of diabetes every day. And for day-to-day activities, it has to be done in the home. And therefore, the second one is we say poking the finger, which is by sugar testing. And the third one is a new device, which is called a glucose sensor, which is very popular in the past few years. I will spend a bit more time talking about this one. So if you would like to test your blood sugar, and you have to know why and then the target. So before meal, most people's target who are having diabetes and with an empty stomach or fasting, the result should be targeted to be between 4 to 7. And 2 hours after a meal, it should be within 5 to 10. And when we say after meal, we start with the first swallow of your meal. So in what circumstances do we have to test our blood sugar? So usually when you're newly diagnosed, or when your A1C is high, or when the doctor is prescribing new medication to lower your blood sugars, but there may be a risk of hypo blood sugar. And well, there also may be other medications that can cause higher blood sugars, like some other medications. And for some professional long-distance drivers, they have to test their blood sugars every 4 hours. And also, if you're on insulin and you're being hospitalized, and your blood sugar will also be tested. And blood sugar monitoring, well, if you are poking your finger, so every time if you do it, it will tell you the blood sugar at the minute. And in order to know the trend of your blood sugar, sometimes we would like to test not only day to day on the same hour. So for some who do your blood testing every morning before breakfast. So this is not done that way. We would like you to test your blood sugars at various times of the day so that we know the trend of your blood sugars. And now there are a lot of different devices which provides cell phone apps. So they can be connected for your Bluetooth to Bluetooth, which can be connected to the clinic of your doctor. So therefore, also here are examples of how to monitor and test your blood sugars. So for example, so one day you test before and after meal, before breakfast, and the second before lunch and before and after lunch, and the third day before and after supper, or you can even vary that. So the best way is to talk about it with your doctor. So for the glucose sensor, I would like to talk about it. Now, the technology is just like, it is a very, very narrow needle, and it is placed under your skin, and you can feel the fluid between cells and to test the sugar in that. So if you poke your finger, it goes to your blood vessel. But for this device, usually it's placed in your arm or on your belly. So because it can report to you your blood sugar every minute, and therefore this sensor can analyze different reports. And if you think that, well, I do not quite understand all these different reports, then you can talk about this with the diabetes nurse or the doctor to understand more. And another thing I hope everybody can pay attention to is the proper injection skills, because now not only diabetes, but there is another thing which is called the GLP-1A injectables, which are commonly prescribed by the doctors. So they are usually in the form of injectables. And I would like to touch on the skills of injection. Now, just then you can see from the screen, the best thing is to use a needle of 4 mm and 32 gauge, because this is already good enough, because the thickness of our skin is on average 2 mm. And if you use 4 mm, the injectable medication will not go into your muscle. And you can see that there are two caps. One is small, one is bigger one. You have to remove both caps before you can give injection. And nowadays there are new needles, and there is a center which you can see on the right, there is something to push so that it will not go into your muscle. And the old one is the left one. So if you're using injectables, pay attention to what needles that you are using. So for proper injection skills, of course, you have to wash your hands. And so nowadays, to put together the injectables, usually you do not have to do these steps. And then usually we are using disposable injectables. However, for insulin, some insulin, they are mixed up, and then you have to shake them up for 10 times. And every time if you need a needle, and make sure that you use a new needle every day, because if you use it more than one time, then it will be easy to hurt your skin tissues. And also, in order to see whether it is working, you have to dial it to 2, and then to push it to make sure that liquid is going out from the tip, and making sure the needle is working before you give yourself the injection. There are different parts of the body that we can do injections. So 2 fingers away from the belly button. That part we cannot give injections. Otherwise, the whole belly, we can do that. And also the side of the thigh. And for the for our bump, you can do them on the side. And it is important to rotate between different injection areas. And I will again to explain further later on. But, I have a system to remember. Maybe in the morning on this side, in the afternoon, the other side, and in the evening, that side. So you have a system that will be best. So if you do it, make sure that you have facing at 90 degrees and slowly squeeze in the water, the medication. So make sure you see the 0, and then before you pull it out. And after you are done, you can put it in a little box, and you can buy that from the pharmacist. Now, the diagram on the right reminds you that you do not have to press hard. And if you would like to make injections more comfortable, so use the finest needles. I have just talked about it. And also try to relax, reduce your anxiety, because the more anxious, the more painful. If you are worried that you are not very good at it, then try to do it on another object. So if you do it properly, actually it's pain-free. So if I said, if you repeat it, then the needle will be blunt, and the medication works best in room temperature. But if you have been putting it in the fridge, take it out 15 minutes before injection. So actually, you don't have to put it into the fridge if it's been opened. And if you keep re-injecting to the same location and same site, you can see from the diagram that that area can be bumpy or hard. So when you inject, well, it may not hurt, but it is not good for the body to take in the medication. It's not as effective. So try to avoid the hair roots, the scars, and then if the injection is a really large one, then you talk to your doctor. Maybe you can consider splitting it into 2 doses into different areas. And here we have some community resources, and there is resources in Chinese as well. So I'll quickly go through that because I'm going to touch on another important skill, and which is to learn how to take care of your food, which is very important because if a blood sugar is not controlled properly, it will affect the blood vessels as well as the nerve in our feet, and that may cause a feet problem. And if you have feet problem, then it will affect the quality of life. And also it will increase the risk of death. And the most important thing is prevention. Prevent having foot problems. So I have got some tips how to prevent that. The first tip is to every year, so you can ask diabetes nurse or the doctor to do regular and thorough foot examination. So in this way, you can detect problems and tackle with it as soon as possible. And the second thing, if you cannot touch your toenail or your vision is not as good, then have a foot care nurse to take care of your nails. And the third tip is, in certain situations, people have to who are exposed to higher risk. For example, people cannot feel heat or cold or sensation, cannot feel pain. And for more elderly people, their skin tend to be thinner. And for diabetes patients, the skin tend to be drier. Another thing is if you are not having very good nutrition or you are certain medications like steroids and anticoagulants, and then the risks of having problem will be increased. And also if you have poor balance or mobility, and you may be bumping into objects and then causing injury to your skin. And this is something to avoid. And the next tips is to try to get proper shoe wear. Now, it is important to get the proper size so that it can be properly fitted. So a pair of good shoes, how does it look like? So there is enough support. And when you're walking, you can feel secure, and the heel should not be more than 1 inch. And the sole is better to be a bit thicker. And there are some design down at the bottom to for anti-slippery. And also between the big toe and the heel, there will be room for 1 finger. So when you're wearing shoes, making sure that there is nothing foreign like sand or other things inside the shoe to avoid friction. And also wearing socks. The socks, I hope that it is in light color. Why is it so? And also is it is air breathing so that it is not creased. The reason is you can, if you have any signs like redness or swollen, then go to the doctor. And things to remember will be, this is the 6 tips. So first of all, you have to check your feet to see whether you have swollenness, whether you have injury. And after your shower, make sure you dry it up. And every day put on moisturizers on the top, on the bottom, but don't put it between the toes. And when you're cutting the toenails, don't make it too short. It has to be flat, not curved, and also file it. And if you have you have a colorless, don't use knives. So if you are soaking in your bath, make sure you test the temperature of the water before you put in your feet. Don't smoke, because smoking would harm your blood vessels. And then we have talked about shoes, and don't walk barefooted. So you have to walk even indoors wearing your slippers. And then for your nails, if they become thickened or ingrown, then you go to your doctor. And for the skin, if it's calluses, a blister or crack, see a doctor. And where there is redness, infection, go to your doctor. And if you had amputation, or you had infection in your feet, then you have to pay attention to the following. So for these people, they have to go to the doctor if you have foot ulcer or amputation. Now down there, woundscanada.ca, there is a lot of information, and there is a lot of video, and they are provided in English. And also they have a Facebook group for people to join in, and there is English information. However, this website also includes some Chinese information. I have put a little bit on the screen, and you can print it out and to study. And also on diabetes.ca's website, there will be information, and you can see some Chinese information and resources on the screen now. There is other resources in the community I would like to mention. So for the diabetes care team, you can see different expertise. So those on the left, these are people you would see regularly. And then people on the right, you may not be seeing them regularly, but only when needed. So for the community source of foot care, I would really like to bring your attention to one thing, which is for foot care nurses, which is the fourth one. So there will be nurses who can come into the home, who can cut your nails, who can examine your feet. And then you go onto the website, you can type in your address, and you can know which nurses work in your area. This is another one for foot doctor. You can go onto this website. And another one is for smoking cessation program. You can go online to find out more information. So all the resources above, you can reach them through all these different emails. And for Fraser Health Authority, they have Chinese information. And for Vancouver Coastal Health, they have a lot of information. And for the Dexcom.com, it is about glucose sensor. And the last one is also about the glucose sensor. And for Diabetes Canada, there is a lot of updated information regarding diabetes. So this is all my sharing today. Thank you, everybody. Oh, thank you, Nora. So you have so much information. So this is just a little bit of the information taught in the class. Oh, so this is so important because of the blood sugars, and it can vary every day and from hour to hour, and how to test is a very important message. And also just the feet, there is so much information to take in order to protect the feet, so that the feet cannot be injured because of high blood sugar. And then if the blood vessels which are furthest from the heart heart and they are affected. And especially when you're when you're older, you tend to be colder in the feet, then it will be easy to have injury and then which is go unnoticed. So through the education center, our awareness is being raised, and I hope the risk of amputation can be reduced, because with improper care, then amputation may really happen. So I think the most important thing is to examine and to put on moisturizers to prevent cracks and dryness. So thank you, Laura. Thank you very much.
So if you are taking part for the first time, you have not been registered in our email list, you can scan this QR code to join our iCON mailing list. And in future, whatever activities we have, we will let you know in the first instance. I want to thank our community partners who are, well, there are very many, you can see. They are Vancouver Coastal Health, Fraser Coastal Health, CMHA, and South Vancouver Neighborhood House, Richmond Cares, Family Caregivers BC, UVic, Self-Management BC Institute on Aging and Lifelong Health, Vancouver Divisions of Family Practice, and Vancouver Public Library, as well as Villa Cathay Care Home and Richmond Gives Caregiver Hub, Mosaic Caregiver BC. Thank you to all of you to help us promote and advertise this program to the public out there. And I also want to thank our media partners. They include Fairchild TV, Omni TV, Ming Pao Daily News, and as well as Singtao Daily Group. And I also want to thank, over the last 2 days, the hubs that were open have been open to the public. They include CLC Health Center, Jackson Lamb Adult Daycare Center, Day Center, South Vancouver's Neighborhood House, and Villa Cathay Media Partners. Those are our media partners. You want to watch those presentations again, as well as other presentations, you can go to our www.iconproject.org website, as well as icon.support@ubc.ca to review those presentations.